Welcome to Dr. Balga's podcast for the Curious Doc. Today is May 20th, 2026. This video is on a Lancet article published on May 16th titled Efficacy and Safety of Cefepime Nacubactam and Erythroneum Nacubactam compared with imipenem cilastatin for complicated UTI or acute uncomplicated pyelonephritis. The acronym is Integral 1 study. It was a double-blind randomized phase 3 trial. There was an accompanying commentary titled Emerging beta-lactam and beta-lactamase inhibitor strategies for complicated urinary tract infections. Complicated urinary tract infection and acute uncomplicated pyelonephritis increasingly involve multi-drug resistant gram-negative organisms, including extended spectrum beta-lactamase producing Enterobacteriales. Nacubactam is a novel diaza bicyclooctane beta-lactamase inhibitor with dual antibacterial activity. The study investigators conducted a global phase 3 randomized double-blind multicenter trial across 79 sites in Europe and Asia in adults above the age of 18 years. They were randomized 2:1:1 to Cefepime Nacubactam combination, Erythroneum Nacubactam combination, or imipenem cilastatin every 8 hours for 5 to 14 days. 614 were randomized. Microbiological modified intention to treat population was 431 individuals. The mean age of the study cohort was 64.8 years. 53% were male. 25% had extended spectrum beta-lactamase positive pathogens. The primary endpoint, a composite of clinical plus microbiological success at test of cure. The non-inferiority margin was 15%. What they find? Primary success, 82% with Cefepime Nacubactam combination versus 72% with Erythroneum Nacubactam combination versus 61% in the imipenem cilastatin group. Difference versus comparator, 21.3% and 11.4%. So 21.3% were superior plus non-inferior, while 11.4% was non-inferior. Microbiological eradication was 86% in the first group versus 74% in the second group and 64% in the imipenem cilastatin group. Clinical cure, 91%. The first group versus 92% in the second group versus 88%. Follow-up success, 69% in the first group versus 65% in the second group and 62% in the imipenem cilastatin group. Treatment emergent adverse events, 33%, 30% and 43%. No treatment-related deaths. Limitations of the study, it excluded carbapenem resistant pathogens. The study cohort was predominantly white and Asian. No oral step-down strategy. The study was not powered for Erythroneum Nacubactam superiority testing. The real-world generalizability may be limited. Key takeaways: Cefepime Nacubactam demonstrated superiority to imipenem cilastatin, and both Nacubactam combinations achieved non-inferiority. These are promising new therapies for resistant gram-negative UTI with favorable safety profiles. Editorial caution and stewardship. The editorial is warned against broad-spectrum carbapenem-sparing use until additional evidence from ongoing Integral 2 trial becomes available. Durability concern. The initial superiority at test of cure narrowed during follow-up, with recurrent rates remaining relatively high and similar between treatment groups. Resistance ecology, the authors warned that premature widespread use could accelerate resistance against what may become clinically relevant therapies for multi-drug resistant gram-negative infection. Key editorial quote: at some point in our history, we need to hold back on global use of an antibiotic. Generalizability: the study excluded carbapenem resistant pathogens and primarily enrolled white and Asian populations from Eastern Europe, China, and Japan. Economic concern, potential high pricing, and global access inequities were highlighted as future barriers. Clinical pearls: Cefepime Nacubactam achieved superiority, strong microbiological eradication, encouraging ESBL subgroup results, low adverse events than comparator, potential carbapenem-sparing strategy. This is an infographic on this article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.